Live from the local station, News 4 Jax starts now.
Florida is ending the week with the highest number of new coronavirus cases per capita in the country. And tonight, a dire warning from a local pediatrician as schools get ready to welcome kids back in just 2 weeks.
COVID-19 is an equal opportunity infection. There's no reason that a child cannot get infected or child has any less chance of getting infected than an adult. It just so happens children don't get that ill.
We're continuing to speak with medical experts about reopening schools amid the COVID-19 pandemic.
Earlier today, we told you a local pediatrician sent a letter to the Duval County School Board warning that the results of reopening school buildings would be deadly. Well, tonight, News 4 Jax reporter Joe McLean is speaking with other medical experts about that claim. Joe, Governor Ron DeSantis also weighed in on that subject today.
He did, and I was hearing wildly different opposing viewpoints on the level of risk associated with opening face-to-face classes this fall.
And so for me, I look particularly at those elementary school kids, and the science on that is just overwhelming. Yes, they're at almost zero risk, but even more than that, transmission from an elementary school to an adult is extremely rare.
The decision to continue brick and mortar classes next month shouldn't be made out of fear, and kids need to be back in the classroom. That was the message from Governor Ron DeSantis on the same day that Dr. Jeffrey Goldhagen, a pediatrician and former director of the Duval County Health Department, sent a letter to the Duval County School Board saying that move would prove deadly.
I think that it's most likely that there will be deaths occur from opening the school.
A school district spokesman released a statement today saying, quote, the district has been working very closely with local doctors and the Department of Health. The school board had multiple medical professionals provide guidance during its workshop earlier this week. I asked pediatric infectious disease expert Dr. Mobeen Rathore about the letter and the risk to young people.
COVID-19 is an equal opportunity infection. There's no reason that a child cannot get infected or child has any less chance of getting infected than an adult. It just so happens children don't get that ill.
About 21% of the reported COVID-19 infections are patients under the age of 25. 5% are under 15 years old, according to state data. Out of the 4,805 COVID-19 related deaths reported in the state, 14 were patients under the age of 25. That's 0.003%. But the risk to children isn't the only concern, according to Rathore.
I'm actually as concerned, if not more concerned, about the teachers and the other staff, school staff, them getting very sick and having poor outcome.
As families decide whether to send their children back to school buildings this fall, Rathore says the health and safety of everyone in that household needs to be considered, not just the student's risk factor. We also looked at the latest recommendations from the American Academy of Pediatrics about reopening schools. Its guidelines say, quote, the AAP strongly advocates that all policy considerations for the coming school year should start with a goal of having students physically present in school. Now, that recommendation, of course, was last updated June 25th, so nearly a month ago. The Academy also noted that safety measures are able to mitigate but not eliminate risk factors. Reporting live, I'm Joe McLean, Channel 4, the local station.
Well, that warning comes as we're learning more about an unpublished report prepared for the White House Coronavirus Task Force that lists 18 states in the red zone, including ours. That means these states have had more than 100 new cases per 100,000 people in the last week. The report is dated July 14th and says bars and gyms in red zone areas should close, gatherings should be limited to 10 people or fewer, and residents should wear masks at all times when outside their homes.